I saw this post earlier on today and my heart was broken. And I also know that the team involved would feel devastated by what has happened and the patient herself. My heart goes out to her. Now, having said that, I said working as a GP or a family physician is one of the most difficult jobs amongst medical specialties. And being that you have to rely on what the patient tells you, the investigation you do in primary care, which is just basic things such as observations. By that I mean blood pressure, oxygen levels, temperature, respiratory rate, and urine dip, and the physical examination you could perform on the patient. Other than that, you need to always ask in-depth history from the question to be able to risk stratify the ones that need urgent referral to A&E and the ones that need a 2 week wait referral for cancer. Now, that said, it's also imperative that the patients do not undermine their symptoms. If a patient comes in and say, "Oh, I've been having this chest pain, but there's nothing to worry about, doctor. I just wanted you to be aware." Immediately, I would say, "Tell me more about the chest pain," and I would be sending them to A&E. And I would explain to them that we do take chest pain seriously, and as such, I don't want us to ignore it. Or you come in with abdominal pain and you've been vomiting, I want to send you to A&E. Or you've got back pain that is now waking you up from sleep, night sweats, weight loss, family history of cancer, I'm sending you to urgent 2 week wait. And if I'm thinking that this could be a metastatic spinal cord compression, I'm sending you immediately. I'm calling the ambulance for you and I'm sending you to A&E. Now, this is also for patients. Never undermine your symptoms. Say it as it is. If you're worried about cancer, doctor, I'm worried about cancer. I've seen a couple of your colleagues and I'm still having the symptoms and I cannot sleep. It is not impacting my life, it's impacting my mental health. Say it out. There is no doctor that you tell that you're worried about cancer and wouldn't want to find out why you're worried about cancer. And they wouldn't rule out the red flags of cancer. If you've got heavy periods, don't undermine your symptoms and say, "Oh, everyone do have heavy periods. It's normal for people to have painful periods." It's not normal. If you come into my clinic and say you've been having heavy menstrual periods, the first line of management I'm going to be giving you is that I'm replacing your iron even before I get the blood test back and I'm requesting a scan because you can never say, "Oh, because this person is in this particular age range, they can't have this, they can't have that." I've seen a young lady with fibroid, I've seen a 21-year-old lady with ovarian cancer. So never say never in medicine. If you found this video useful, it means other people would. Please like, share, and save for later. And once again, my heart goes out to this lady.